Hello. Thank you everyone for attending my presentation this morning on improving the quality of cardiopulmonary resuscitation in Hopewell Township. I'd like to extend a special welcome to Elaine Cruikshank-Borges of the Hopewell Township Governing Committee. She serves as CFO and Treasurer, so thank you for being here tonight. Without further ado, I'd like to give everyone an overview of the topics we'll be covering this morning, starting with the problem, which is inadequate chest compressions on Hopewell Township ambulances, the solution, which is an investment in a mechanical chest compression device, my plan of action, my budget for the aforementioned plan of action, and in conclusion, some closing remarks and time for questions. First off, inadequate chest compressions are a severe danger, and we can understand this by understanding CPR and why it exists as a medical procedure. So CPR is a medical procedure that is comprised of chest compressions and rescue breaths in order to resuscitate a victim of cardiac arrest who is clinically dead. So the chest compressions serve the function of circulating blood to different areas of the body, such as the vital organs like the heart, the liver, the brain, organs that we cannot live without. So if these compressions are inadequate, enough oxygen cannot reach these vital organs and permanent tissue death can be a result. This is a definite problem because it can lead to patient death. So despite the fact that these compressions are overwhelmingly important, only about half of these compressions performed by rescuers in the emergency medical services reach the recommended rate and depth prescribed by the American Heart Association. So if you look at this figure right here on my presentation, it shows the recommended amount of compressions per minute performed adequately, as opposed to the measured amount of compressions performed adequately, shown in two different studies, one done by the McDonald research team and one done by the Young research team. So as you can see, they're about halfway to the recommended amount, which, considering that this is a procedure that is saving people's lives, it should not be this low. So it's important to look into why this is happening, why we have this problem of inadequate chest compressions. And one of the causes is rescuer fatigue. For anyone who's ever performed CPR, it's obvious that this is a very physically demanding procedure. You have to be on top of a person performing this thrust motion over and over again, and it's very demanding. So the quality of compressions often decreases with time because of the physical demand. If you look at this figure right here, made by the McDonald study, it shows that the quality of compressions decreases from about 52% accuracy to 38% accuracy over 5 minutes. Now, if you think of a town like Hopewell Township, which is 60 square miles, where transit times on ambulances can take up to 20 minutes, then it should be a problem that this trend is happening, because if this is how the quality declines within 5 minutes, within 20 minutes we can imagine that an even greater decline would be taking place. Now, participants in this study also noted, 79% of them, that fatigue affected their performance. So this is something that rescuers are aware of. Decay of skills is another definite problem, and this is the principle that the quality of chest compressions will decline after training, after these principles have just been reinforced. So another study done by the Mapatos research team found that emergency room nurses who were asked to perform chest compressions on a mannequin directly after training, about 39% of them passed this test, and 10 months later, 15 of them passed the test, suggesting that the time gap between training and the test caused failure in about 24 of these nurses. So this is also a definite problem because the New Jersey Emergency Medical Services requires that CPR training only be taken once every 2 years for rescuers. Now, if this decline is taking place in 10 months, then 2 years is definitely too long of a period to be waiting. So up to this point in the presentation, we've been measuring very physical sort of factors, but rescuer attitudes towards CPR is a less physical factor that still influences the quality of CPR received by patients. So CPR is a procedure that can often affect the patients in terms of injury. It can cause thoracic injury in 42% of patients. So this is a dangerous procedure in a sense, that many are being injured by it, and it's in that case not surprising that many rescuers feel ambivalent towards it. But at the same time, it's important to realize that the patients receiving CPR are clinically dead to begin with. So any sort of injury is at the expense of saving a life. Anyway, so 25% of those rescuers surveyed said that the benefits of CPR do not outweigh the risks. And breaking ribs made 54% feel uncomfortable. So we can imagine that this subconscious sentiment would influence the quality of CPR, because if you're not full-heartedly behind the procedure that you're giving, the quality of that procedure should be less. So, moving on towards the solution, there was a study that measured the effectiveness of mechanical chest compression devices on an ambulance. Now, in this study, basically what the research team did was they compared the performance of highly skilled paramedics giving manual compressions to a machine giving mechanical compressions. Now, the mechanical compressions were 99% accurate, whereas the manual were only 66% accurate, despite the fact that they were performed by very skilled paramedics. Now, this suggests that a mechanical chest compression device is overwhelmingly more effective than a manual one. And if this device is excelling on an ambulance, which is the environment it would be used in Hopewell Township, then it's something we should be looking into. So a more long-term study was done in Oslo, Norway. Data was collected over 3 years regarding